Good morning, everyone, or good afternoon, and thank you for joining us, and welcome to the webinar. Today's webinar is entitled, What Businesses Need to Know About the Provincial Roadmap to Reopen. This is the second webinar in our Making Workplaces Safer here in York Region. And next slide, please. So I'd like to introduce myself. My name is Scott Chalua, and I'm the Acting Director for the Infectious Diseases Control Division, as well as our COVID-19 Operations Chief in the Health Emergency Operations Center. It's also my pleasure today to introduce our presenter, Dr. Leon Jenisov. Dr. Jenisov is a public health physician with York Region Public Health. He joined York Region in April 2020. He was previously the Chief Physician at the Ontario Ministry of Labour. He retired from the Ministry of Labour in 2019 after 35 years of service. Dr. Jenisov is a Royal College specialist in occupational medicine, as well as a certified family physician. He's the recipient of the Queen Elizabeth II Diamond Jubilee Medal and also of the Ontario Volunteer Service Award. I'd also like to introduce Vito Chafari, who will be assisting Dr. Jenisov in the question and answer session. Vito's been working for public health for over 3 decades with extensive experience in many health protection programs, including tobacco control, food safety, and enforcement. And he recently gained significant knowledge of the Reopening Act legislation as a result of his current position. As a reminder, I just want to remind everyone that before we begin, that the meeting is being recorded. During the meeting, you'll have the opportunity to ask questions, and there's a Q&A box on the top corner of your screen. Questions will be gathered and sorted to avoid duplication and ensure the best response can be provided. And although your name will not appear on the screen to attendees, producers and attendees would have access, or producers and presenters may have access to this information. In addition, if you have any questions about the recording of the webinar, please contact the email address on the screen, heocommunications@york.ca. And to ask a question, you can select the QA icon at the top right-hand corner of the screen, type in your question in the compose box, and then hit send. The questions, as I said, will be screened by the moderator and posed to the presenters at the end, and then the question and answer session will follow the main presentation. In the meantime, please add your sector that you represent in the Q&A section so we have a good idea of which attendees are present. And as of right now, we have 119 people logged in, which is wonderful. So thank you, and I'd like to now turn it over to Dr. Leon Jenisov, who will begin the presentation.
Thank you, Scott. Can we have the next slide, please? So we'll be discussing the provincial reopening plan, and I'll be providing an overview of the plan. So next slide, please. So first of all, York Region Public Health would like to thank all employees and employers in our community who continue to practice excellent public health measures to stay safe while at work. The purpose of today's webinar is to discuss what you need to know about the province's roadmap to reopen, which is a 3-step plan to gradually lift public health measures. The plan is based on the province-wide vaccination rate. As you can see on our screen, for step 1, the rate was 60% of adults vaccinated with 1 dose. And for step 2, it is 70% of adults vaccinated with 1 dose and 20% vaccinated with 2 doses. And for step 3, that we're all looking forward to in the future, 70 to 80% of adults vaccinated with 1 dose and 25% vaccinated with 2 doses. And the province is also, in addition, looking at improvements in other key public health and healthcare indicators. So we know Ontario entered step 1 on June 1st and step 2 on June 30th. Based on York Region's vaccination program, here in York Region, we've administered over 1 million doses of vaccine, resulting in vaccination of over 80% of York Region adults with 1 dose, and over 49% of York Region adults have been fully vaccinated, which is great news. This means York Region has one of the highest vaccination rates in the province. So I'd like to thank everyone who have rolled up their sleeves to reach these milestones and encourage everyone else to go out and get your vaccine. Part of the province's plan is to remain at each step for 21 days to evaluate any impacts on key public health and health system indicators that we have from the vaccine program and other public health measures. Now, I know that many employers are hopeful to move to the next step sooner. However, the new Ontario Chief Medical Officer of Health, Dr. Kieran Moore, he has stressed that we really need 21 days in each step as a minimum to understand the impact of opening on our communities, because we never want to take a step backwards, we only want to move forward. So Dr. Moore is really cautious about reopening too quickly, given the aggressiveness of the Delta variant and its potential to spread quickly. And we've seen, for example, in the UK, where they're experiencing a Delta outbreak, some of the issues with potentially opening a little early. So Dr. Moore has also stressed that the importance of being vaccinated has never been more critical than ever, which all of us here at York Region Public Health agree with and are 100% committed to supporting. Next slide, please. Thank you. So the provincial regulation 26320, the rules for areas at step 2, this regulation lays out the complete list of public health and workplace safety measures and restrictions. So you're going to want to have a good look at the regulation, and on the ontario.ca website, which has a complete guide for opening for step 2, and also an important document, the latest public health measures, advice and restrictions on step 2, which provides a detailed explanation of what's in the regulation. If you need specific clarification on the regulation, however, you want to please consult your own legal counsel or call the province's Stop the Spread business information line at 1-888-444-3659. And you can see that number at the top of your screen. That's the province's Stop the Spread business information line for businesses to call for questions regarding the various steps. Now, in addition to the steps in the provincial regulation, York Region businesses and workplaces are also responsible for following the letter of instruction issued by York Region's Medical Officer of Health, which outlines some additional health measures required of employers with respect to cooperating with York Region for the purposes of investigation and contact tracing measures of cases and supporting vaccination of your staff. It is through continued cooperation, diligence, and your efforts that we will help keep our York Region communities safe. And please refer to the websites listed on the slides for further information for businesses, for reopening, and for travel. Travel is an important point. As an employer, it is important to keep up to date on the latest travel and restrictions. The federal government's website provides details on requirements regarding testing, quarantine, and borders. And for example, starting on July the 5th, there are now some new exemptions for fully vaccinated travelers entering Canada, which are important to keep up with. Also, recently, York Region Public Health has released the COVID-19 Vaccine Digital Partner Toolkit. It's on our webpage. It's our way of sharing accurate, clear, and credible information directly to you to help us raise vaccine awareness and address common questions, myths, and concerns that you and your employees may have. Have the next slide, please. So now we're going to look at, in a bit more detail, the provincial reopening plan for step 2. Next slide. So as you're aware, Ontario moved into step 2 on June the 30th. Step 2 focuses on further expanding outdoor activities and resuming limited indoor services, including salons and barbershops with small numbers of people and with face coverings being worn, and in stores and shopping malls, which are now open. I'm just going to give a brief summary of what you see here in the blue box on the slide of restrictions. The capacity guidelines go into some of the capacity limits for essential and non-essential retail businesses, restaurants and bars, personal care services, and sports and recreational facilities. And I'll just summarize them now, as you can see in the blue box on the screen. Outdoor social gatherings and organized public events are permitted up to 25 people. Indoor social gatherings and organized public events are allowed with up to 5 people. Essential and other select retail businesses are permitted at 50% capacity, and non-essential retail is permitted at 25% capacity. Personal care services, where face coverings can be worn at all times, are at 25% capacity and with other restrictions. Outdoor dining is allowed with up to 6 people per table, with exceptions for larger households and some other exemptions and restrictions. Indoor religious services, rites or ceremonies, including wedding services and funeral services, are now permitted at up to 25% capacity of the particular room. Outdoor fitness classes are limited to the number of people who can maintain a 3-meter physical distance. That's an important number. It's 3 meters physical distance for outdoor fitness classes. Outdoor sports without contact or modified to avoid contact with no specified limit on the number of people or teams participating are allowed with a number of restrictions. And again, you have to refer to the regulation for specific details. Overnight camps for children may operate in a manner consistent with specific safety guidelines produced by the Office of the Chief Medical Officer of Health. Outdoor sports facilities are allowed with spectators permitted at 25% capacity. Outdoor concert venues, theaters, and cinemas, all outdoors with spectators, are permitted at 25% capacity. Outdoor horse racing and motor speedways are allowed with spectators permitted at 25% capacity. And outdoor fairs, rural exhibitions, and festivals are permitted at 25% capacity and with some other specific restrictions listed in the regulation. Remaining closed, this is important, remaining closed are indoor pools, saunas, indoor fitness centers, and other indoor recreational facilities. They remain closed. There are a few limited exemptions, and have a look at the regulation and the guide for step 2 for those, but in general, all these facilities indoors remain closed. And the next slide, please. So to maintain our progress against COVID-19, the community and employers must continue to adhere to public health advice and measures, including vaccination. And you may get questions from employees and patrons that have been vaccinated about the need to adhere to certain public health measures. However, at this point in time, despite vaccination, all public health measures must be followed, including screening, that's for either active or passive screening, depending on the type of business or workplace, and screening of workers and patrons. So again, the details are in the regulation or in the guide, and in the guide for step 2, and the list of public health measures for specific businesses in step 2. Personal protective equipment is still required in certain, in many situations, including masks, face coverings, and eye protection. Physical distancing is important. Line management means those lineups to get into stores and malls. There has to be appropriate distancing as specified in the regulation and the guidelines. So that's very important in the malls and stores to manage those lines, making sure people are appropriately distanced. Cleaning and disinfection remains essential, and we have to keep a rigorous eye on cleaning and disinfection protocols. Workplace safety plans are mandatory. There's an example workplace safety plan on the Ontario website. You can also go to the york.ca website to get links to that. And again, where possible, working from home. The screening details, by the way, as I mentioned, for active or passive screening for patrons or workers, the specific online COVID screening templates on the ontario.ca website. And for details on this entire list of things on the elements on the slide and in the blue box, please refer to the public health measures section of Ontario's reopening plan and consult the regulation. Next slide, please. So now we'll discuss a little bit about hopefully the near future and the provincial reopening for step 3 and what we might see here. So the plans for step 3 haven't been finalized yet. The regulation hasn't been finalized yet, but here's an outline of what we may expect and what you can start to prepare for, hopefully in the near future. So again, thank you. So in step 3, as I mentioned, the province announced that Ontario has surpassed the step 3 vaccination targets, but we're going to remain in step 2 for a period of 21 days. And this will allow the province to evaluate any impacts of moving into step 2 on the key public health and healthcare indicators, and allow the most recent efforts at vaccinations to reach their full effectiveness. Although the specific details of step 3 have not been announced, the government has indicated that step 3's focus will include expanding access to indoor settings with restrictions, including where there are larger numbers of people and where face coverings in some situations can't always be worn. So we will be able to enjoy larger indoor and outdoor gatherings with size limits. There will be increased capacity guidelines for different settings and businesses. And again, one will have to continue to meet that minimum 2 meter distance physical distancing. So for example, retail capacity in step 3 hopefully will increase for essential and non-essential limits, non-essential retail businesses to permit physical distancing of 2 meters as the capacity limit. Similar for restaurants and bars for indoor dining with capacity and other restrictions. Personal care services in step 3, again, this is proposed, but they may open with capacity limits to permit physical distancing of 2 meters and with other restrictions in place. Sports and recreational facilities should be able to open indoors in step 3 with restrictions and continue outdoors to open up a bit more with restrictions. Short-term rentals, hotels, motels, lodges, resorts, and other shared rental accommodations will be open. And those indoor facilities that were closed in step 2, such as indoor pools, saunas, whirlpools, and indoor fitness centers, they'll be able to open in step 3 with restrictions. So for more information, please consult the York Region website, the province's reopening website, and the regulations for more information and relevant restrictions specific to your sector. I just want to emphasize that because the restrictions are very different for the many different sectors that I've mentioned. And again, if you need clarification on the regulation for step 2, as I mentioned earlier, you can call the province's Stop the Spread business information line at 1-888-444-3659. So while we are all ready to get back to business as usual, we all still have a role to play in the fight against COVID-19. As employers, please continue to follow and promote public health measures in the workplace and help increase vaccination for your staff. That's really important. If we follow all these measures and promote and support vaccination efforts, we can move promptly to step 3. And I want to thank you for your efforts in keeping York Region safe. Before we move on to the questions and answer session, I would also invite you to join us for our next webinar in the Making the Workplace Safer series, entitled How to Prevent COVID-19 Infection in the Workplace, Infection Prevention and Control, and Safety Measures, scheduled for July 20th. On June 22nd past, we also hosted a webinar, Tips to Increase COVID-19 Vaccine Uptake of Employees. And all these webinars and presentation slides will be posted on our York Region website. The information and tips from these webinars will help keep our businesses open and our workplaces and communities safe. Next slide, please. Scott.
Thanks so much, Dr. Janisov. So we'll move out now to our question and answer period. And I'll read some of the questions that we did receive through the chat, and Dr. Janisov and Vito can chime in as appropriate. The first question was, now that the number of COVID cases are going down, when can an employer lift COVID restrictions in the workplace? Is there any guidelines?
So, thank you. That's a good question. As I mentioned, we have to continue to follow all the restrictions in step 2. We have to follow some of the specific restrictions listed in the letter of instruction from the Medical Office of Health for York Region. And we have to continue to follow all the measures necessary, even though that we are vaccinated. So even with the cases decreasing, we have to continue to follow all the measures. Step 3, when we move to step 3, that's when we'll be able to ease some of the restrictions. But at the moment, we have to follow all the current restrictions that are in place, all the public health measures, including screening, distancing, capacity limits, masking, eye protection, cleaning and disinfection. They all have to be continued. In fact, they'll all have to be continued through step 3, but it should be easier to manage.
Thanks, Dr. Jensov. The second question, can a fully vaccinated individual work after known exposure or becoming a close contact?
Right, so that's a good question. So first thing is to, the first step should be to avoid exposures and avoid being a close contact. So that being said, for somebody that's fully vaccinated, and in that case, it means at least 14 days have passed since their second dose, they no longer have to quarantine or go into self-isolation for a close exposure or close contact if they're asymptomatic and have no problems. So in most circumstances, people will be able to continue to work in most cases if they're fully vaccinated.
Great, thank you. Is there any indications on when the regulations will be released for stage 3 to allow businesses time to prepare to reopen?
That's a good question. So the province hasn't given a specific date yet. They've given the outline that I've mentioned, but we're still waiting. You and I were both waiting. We're all waiting for the province to release the regulations. But have a look at the step 3 outline. That'll help you prepare.
Thank you. For a small store front that is retail, do we need to capture screening and contact information for walk-in customers?
Vito, can you handle that question, please?
Yes, thank you, Doctor, and thank you, Scott. So the question is, does a small retail that's not a food premise, just like, you know, like some kind of a retail store, you need to have passive screening there where there's appropriate questions so the customer could read, but there isn't active screening for the customer per se. That's very different than your staff. But for customers, if it's a traditional retail store, the answer is passive screening is adequate.
Great, thanks, Vito. In a condominium, both indoor and outdoor amenities are closed. What sector would we fall under?
Vito?
Thank you, Doctor, and thank you, Scott. I'm not sure I understand the question clearly. I guess the question, if I'm going to just sort of extrapolate, is are indoor amenities in a condo, for example, a fitness facility or a pool in a condo. This is a private condo. Is that allowed to operate? Is that the question?
Yes, so both indoor and outdoor amenities are currently closed within this condominium. What sector would they fall under for reopening these amenities, would be my interpretation.
So legally, under Ontario Regulation 263, an indoor pool, I mean, so this is separate from what the condo board policy is. So a condo may decide to operationally keep their amenities closed, but I can only speak to what the Regulation 263-20 sort of profiles for us right now. An indoor pool for the purpose of residents to use, an indoor fitness facility for the purpose of residents to use is allowable.
Thanks, Vito.
Okay.
And yes, so in step 3, this is just more of a comment. There's been a few around this question. In step 3, there will be eventual increases in capacity in both outdoor and indoor gatherings. And that's been outlined on the right-hand side of the steps 3 slides. This question comes from a catering company. Will there be clear guidelines provided with respect to food service, for example, self-serve or service buffets, passed around hors d'oeuvres, etc.?
So the outline for step 3, which is just an outline, may change, does make some references potentially to buffet service, but we'll have to wait for the province to issue the final regulation.
Thank you, Dr. Janisov. In a typical office work environment, when can employees expect to return to work if they're currently working from home?
Vito, do you want to try and handle that one?
The Ontario regulation as we speak says where staff can work from home, they should be working from home. But in terms of like what's deemed to be essential by the employer, that's a discussion between the employer and staff, right? So, the regulation presently says where possible, try to work from home. But that's distinctly different than what the employer may deem to be essential, and that's a very sort of a difficult conversation to have. So it's a difficult question to answer.
I'll just add that if people do return to work, then they have to follow all the public health measures that are in place for that particular type of workplace, whether it be distancing, masks, the screening, and other public health measures that are necessary when people come back into their workplace. They still have to be followed.
I can probably answer this question, but the question's with respect to childcare settings. When can we eliminate the cohort system? And this information will be based on the guidance that's provided by the Ministry of Health, as well as the Childcare and Early Years Center Act with respect to the operation of childcare centers. So until the ministry updates these documents, the existing guidance for these settings will continue to be in place. I'm not seeing any of the other additional questions right now. If there's any further questions, please feel free to use the Q&A button on the top right-hand corner. Another question from a childcare center. Is it allowed for people outside to visit the center physically? Again, these guidance provided by the childcare from the Ministry of Health with respect to the operations of childcare centers would indicate that only essential visitors are permitted. I don't know, Vito, if there's any further information you might add to that.
That's the extent of it. I mean, we can go back and look at the policy and the guidelines provided by the ministry, but I think you pretty well summed it up.
Is there a requirement for working in retail hospitality to provide proof of vaccination?
So there aren't any requirements to provide proof of COVID-19 vaccination right now. So again, we're encouraging everybody to be vaccinated. That's how we're going to protect ourselves. We'll protect our families. We'll protect our households. We'll protect our friends and neighbors and our coworkers if we get vaccinated. And I encourage everybody to be vaccinated, but there is no specific requirement in the public health regulations for proof of vaccination of COVID-19.
Would a facial spa be permitted to open in phase 3 where the clients are not wearing a mask?
Vito, do you have any information on that one?
Thank you, Doctor and Scott. At this point here, all we know is that there's in generality that they're going to relax more rules and offer more sort of options within the personal service settings. We just don't know what the scope of that is. Whether it's, whether they're going to allow any kind of services where masks aren't required. But I think we stay tuned to see when the details come up for the next set of regulations for us.
In a religious or church setting, is serving food outdoors allowed in stage 2?
So the doctor, if maybe I can begin with this one.
Please.
So is an outdoor, so if it's a ceremony, you can have an outdoor ceremony, religious ceremony, to the capacity of whatever your outdoor facility allows, and everyone's 2 meters apart. And so then the question becomes, if that now becomes a reception, unless the ceremony has food attached to it, and I don't know details of what the question is. If it's an outdoor event, and there's details we need to understand, that the outdoor event could be up to 25% of the outdoor space capacity for the purpose of the event. And that may have food attached to it on the basis that everyone's adequately separated. But I think we'd have to have more details on what the specific ask is. Also layered in that, if I can add, Scott, sorry, is if it's not a regular sort of location, there is also municipal requirements for special events permits, and if there's vendors involved, food vendors, there's a food safety component. So I just throw those into the conversations so people get a sense of the broad scope of the requirements.
Thanks, Vito. Vito, can you also clarify about condos being permitted to open their pools and fitness centers? Is this new?
It's new in step 2, but I think what was a piece that we need to sort of clarify is that a condo is deemed to be a private residence. So the indoor amenities such as a pool or a fitness facility, once again, it's not what the condo board may decide to do. That's that board's decision. But in terms of legality, in terms of Ontario Regulation 263, a indoor pool of a condo is deemed to be a private place. The indoor fitness center of a condo is deemed to be a private place, and therefore it's able to open with COVID precautions. Like there has to be signage and distancing and demarcations, and some people have appointments, but as long as it's for the residents only, it's permissible. Now, can we have an outdoor event, like invite outsiders to come? That's a different discussion. But in terms of someone going to lift weights, it's part and parcel of their home. I hope that clarifies.
Yeah, thank you. For storefront takeout restaurants, are these individuals required to capture the names and contact information of patrons?
Dr. Genoa, if I can begin?
Yes, please.
If I understand the question correctly, it is a takeout food premise?
That's correct, yes.
There's no requirements for documenting patrons' names and contact information if they're not sitting down and dining. They still need to be socially distanced. They need to be 2 meters apart. They should be, if they're indoors, they got to be wearing a mask. But for picking up food, there is no requirement for a contact list.
Thanks. Any recommendations on how an office can navigate the regulations if one of the employees is not vaccinated, but does not follow masking and distancing protocols in their day-to-day lives?
So in the office, people have to follow the public health measures that are specified in the regulation and outlined in it, the letter of instruction from the Medical Office of Health in York Region. All that has to be adhered to in the workplace. So the screening, distancing, masking, other personal protective equipment have to be followed by everyone in the workplace.
And can you elaborate, Dr. Janisov, on the 3-meter distancing versus 2-meter distancing?
So the 3-meter distancing is referenced for some outdoor events in terms of fitness instruction and swimming. Right, for pools, for outdoor some of the outdoor fitness activities. The regulations talk about 3-meter distancing. So again, if you have to look at each type of facility and the different type of sports activity, and look at the specific requirements in the regulation, if it requires a 3-meter distancing. But some of the outdoor fitness facilities and fitness activities require 3-meter distancing.
Doctor, if I can add to your comment on the initial question around what can we do if someone is not complying. I mean, I know that it was almost implied, but you also have an opportunity where you can formally file your concern with the Ministry of Labor or Public Health if you have a concern about someone not following the COVID rules, and then there's an opportunity for sort of follow-up by inspectors.
And we have some follow-up questions with respect to public health measures. So are masks mandatory in the workplace? When can masks be removed indoors when large numbers of populations are vaccinated? Questions along those. So at this point in time, and Vito and Dr. Janisov, feel free to add, at this point in time, until the province makes a determination as to whether or not we're going to be loosening any public health measures, the existing public health measures, masking requirements, physical distancing would all remain in place until there is an announcement by the province or any sort of loosening of those regulations at the provincial level. But at this point in time, all public health measures, regardless of immunization status, are maintained.
Correct.
Okay, and for the farmers market food vendors in restricted gated settings, can the food be consumed within the area in a safe manner? Outdoor patios are serving food and people are eating without masks.
Doctor, if I can begin.
Please, Vito.
Outdoor farmers markets that have outdoor dining, if I understand correctly, Scott.
Correct, yes.
So it would be no different than a patio at a restaurant. The expectation is that that you can take off your mask for the purpose of consuming your food, and that I think depending on how it's set up, there's also an obligation for people to also contact trace, because now that becomes a patio, and someone needs to document who's sitting there and along with information. So, but in terms of mask wearing, there's an exemption for the purpose of eating, for when you are eating only.
Thanks, Vito.
Mm-hmm.
With respect to wedding venues, there's a couple questions from wedding venues. When will we have the capacity limits for indoor dining under step 3? And if there's an outdoor wedding taking place, can guests go inside to the bar area to pick up their drink?
So for the capacity limits for step 3, we're still waiting for the word from the province right now on what the final capacity limits are. They have outlined what they potentially may be in step 3 for weddings and other settings, but we really have to wait for the final regulation and announcement from the province to be announced to determine the final capacity limits for step 3. Vito, can you answer the question about the bar?
Thank you, Doctor. In terms of outdoor wedding events, people can go inside for the purpose of going to the bathroom. They can go inside for the purpose of a health and safety reason. For the purpose of going in to pick up your drink, that under step 2 at this point here is not permissible if it's an outdoor event.
Okay. And the last question I see right now is, for office kitchenettes for meals, is it okay for 2 or 3 staff members to sit at one table if all are fully vaccinated without masks?
So they continue to have to be physically distanced. They still have to follow the physical distancing, or if there's plexiglass shields separating people, but continued physical distancing is required.
Thanks. So I haven't received any additional questions at this point in time. So it has gone over a little bit from our originally scheduled time. So I would like to thank everyone for their attendance at today's reopening webinar, for coming today, and really appreciate everyone's participation and engagement. And we look forward to seeing you at our next session that Dr. Leon Genesov referenced earlier in the presentation. So thank you once again. This will be posted online as well. So once it's up and available, you'll be able to access this, the presentation information, as well as the associated question and answers.